how can we find best practice digital tools in Europe? How can we scale up them to improve the quality of diabetes care for our diabetes patients in Europe? The best diabetologist, I always say, is not the diabetologist himself, it's not the hospital, it's not the public health environment. The best diabetologist is the people with diabetes himself, if they perform a good self-management.
Hello everyone, I'm Hugo van Haastert. I'm with the European Commission with DG Santé, and I'm going to tell you about the legislation that's being drafted right now by the European Commission called the European Health Data Space. The third pillar is about the limited free movement of digital health services, such as telehealth and mHealth. This pertains to digital health services and products, where we see there is uneven legislation amongst the member states and the regions of the member states. Not necessarily the same quality frameworks are in place. And the procedures for prescription, reimbursement, liability are also quite fragmented. The European Commission is looking at a number of aspects of digital health to further develop this, such as reimbursement, the interoperability, labeling and/or certification, and of course data privacy and liability issues.
Dear ATTD friends, dear colleagues, welcome to this panel discussion of the European Diabetes Forum ATTD Symposium.
It is important to involve people with diabetes in designing these digital solutions, and here is why. First of all, it's important to involve people with diabetes because they change the focus of what the criteria are for assessing a certain digital solution, and this has profound effects. The design of these solutions will shift slightly. It will still be on outcome, safety and privacy because we care for these things as well, of course. But it will be more on things like quality of life, convenience, usability, integration into our daily lives that are the same as everybody else is out there with or without diabetes.
The introduction of new technology into a clinic could make a big impact on diabetes management, but this requires a strong initiative, a clear awareness of its benefit, and important efforts to integrate its use into routine clinical workflow.
We basically lived through the most exciting period in the medtech industry with a tremendous amount of innovation, and also innovation that's not just looking at improving the outcomes, right, and providing the better access, especially remotely, which was now even more evident as a need during the time of the COVID.
I do believe we need better healthcare infrastructure. I do believe we need better interoperability in the infrastructure that's currently there. We just learned over the last 12 plus months how much is possible if things get a bit out of the ordinary. COVID has taught us that if things are really needed, it's not money that's missing. Suddenly it's just being done. And it's rather red tape and rules and regulations or just convenience or because we've always done it that way that gets in the way.
I believe that important pillars of quality of care should be tackled before investing even more money into creating expensive digital technology.
You are making a multiple number of decisions, clinical grade decisions daily yourself. And so I think combination of technology, that enables some of the efficiency and some of the management that can be transferred in the pocket of individual, which is clearly the most cost-effective way of delivering the care, right? Help minimize through that process the risk of complications, but then also have the incentives and the kind of a different type of engagement of the healthcare professional through these digital means is clearly a way forward.
I think there is a lot to be done on the red tape regulatory side to improve the current status quo.
I believe that the focus should be placed on promoting integrated care combined with appropriate financing and incentives for application of digital technologies and innovative strategies.
Put the proper investments in building up this infrastructure that will enable the future. And the future is really a remote care defined by telemedicine, by personalization.
Let's unite. And unite is also the focus of the European Diabetes Forum. The benefits of digitalization for diabetes resides both in the promise that it will improve the outcomes and management of care, and also that it will help people with diabetes lead a better quality of life.